A dirty mouth can kill you. There is one cause of both gum disease and cardiovascular plaque. People with gum disease have dangerous bacteria such as Porphyromonas gingivalis and Treponema denticola in their dental plaque. The scary part is that the same bacteria can also be found in coronary plaque. It's also been found in clots when people had heart attacks. This is in the artery of your heart. Many people think that oral health is just about white teeth and fresh breath, but believe me, it's much bigger than that. To fix it, you just need to eat the right foods, keep your mouth clean. So, there are 202,234 practicing dentists in the United States. All but 100 of them will go to work today and they will drill, they will fill, and they will bill. That's what they do. They literally have to trip over signs of cardiovascular disease, plaque, and bleeding gums. Clear evidence that this patient is slowly dying and they're tripping over it, and they don't mention it. Now, this is not in 5% of the patients. This is not in 20% of their patients. This is the vast majority. Our guest today can tell us what portion of people have dental disease, which indicates cardiovascular disease. This is like the situation with doctors in the US. We supposedly have the best healthcare manpower in the world, but how much are they helping? The medical industrial complex is here to make money. Even though metabolic disease is slowly killing way over half of us, and I'm not talking 60 years and older, I'm talking 18 years and older. Metabolic disease, metabolic disease is killing us. Unfortunately, 3/4 of doctors don't know how to diagnose it, let alone treat it. Dentists are the same way. The vast majority drill, fill, and bill. This situation's not helping. So it's up to us. We have to protect ourselves. What can we do at home? How can we treat our mouth such that it's not creating metabolic disease? A friend of mine recently gave me a device. She said this thing would help me reverse dental plaque and therefore arterial plaque. Now, this was not my first rodeo. And you see, I know people in that 100 group of dentists that does more than just drill, fill, and bill. It's called the Wellness Dentistry Network. In fact, I know the fellow that started it. And in fact, he's here with us today. So Doug Thompson's going to talk a little bit about what we're discussing today. And he'll help us wade through this and decide, how can we take care of our own mouths at home to improve and protect ourselves from cardiovascular disease? Doug?
Hey, Ford, thank you. Thanks for the kind introduction. And, everything you said in the intro is true. And it's amazing today that what we've learned about the medical world and how it correlates with oral conditions that, significantly affect whole body health, why many more of us aren't doing that. And I'm going to be an ambassador to get my colleagues to step up and start doing that. And that's why we created the Wellness Dentistry Network. It's amazing. But yeah, we can look in the mouth and, we can see a lot of things very quickly that could be detrimental to your health and no question contribute to a lot of diseases. And, we can talk about that as we go along, what those are and what we can do to prevent it.
So in fact, you brought a deck and we're ready to talk about it. But before we do, we have Heather with us today. And Heather, I just wanted you to say hello to the group.
Hello, everybody.
Hi, Heather.
And as we were talking, Heather's got a new studio there. It looks great.
Thank you.
So, Gilbert, you want to show those slides? There we go.
Yeah, and this is the network for it, and just wellnessdentistrynetwork.com. On there, there's a find a wellness dentist. So for people that want to look up some dentists in their community or in the world near them, they can do that. And we're continuing to build out this network. But this is a movement that's just getting going. So it's going to be a lot of fun, and it'll take me well into the end of my career for sure. But it's just an amazing opportunity for us. And what you'll see on the first slide after the intro slide is that the whole world years ago, 20 years ago, Ford, and you talk about this all the time, learned that inflammation was really killing us. And so the idea was, what could we do in the mouth, or what could we see in the mouth that could be inflammatory? Because inflammation is the key word. I think now, they've changed the word to oxidative stress,
Yeah.
sharpen the pencil a little bit, but it's inflammation that causes the big issue. So your mouth can be a serious contributor to whole body inflammation. And then not long ago, books have come out on the topic of what does excess inflammation do to you. And what you so eloquently described is, inflammation is now responsible for redefining cardiovascular disease, and it's the driver of heart attacks and strokes. So I never thought that I would be sitting on an opportunity to actually prevent a heart attack or a stroke. But man, we're doing that every day. When we see people that have harmful bacteria that cause systemic inflammation, we can do something different. So the book is significant because it was the first redefinition of heart disease, if you will, as an inflammatory condition of the blood vessels, not just a cholesterol problem. And I think, Ford, you've been talking about that for years. And we go back some time in this discussion. And then on the next slide that you have, it shows how the periodontal pathogens or gum disease causing bacteria that live in your mouth, how they can affect all these different areas. And what I was so eager to share with my dental colleagues is that not only is medicine kind of redefining this inflammatory disease of the blood vessels, but when we get two or more of these or multiple inflammatory issues together, then they have a cumulative effect on the body, and it really adds up. But what's the beauty for your dental hygienist and the dental assistants and the dentists in the world? On the next slide, it shows that basically the bugs live on and around the teeth, and only we can take them off. Now, you can take some off at home. However, if they get really entrenched, you're going to need some professional assistance to help diminish that population, if you will. So that's the purpose of these photos, is to show the area around the tooth where you might get that popcorn hull stuck or something stuck in there. Well, I can tell you a lot of stuff grows down in there, and it can be very harmful to your health. That's the idea. You want to be able to professionally remove it, and we want to give patients tips and tricks on how to remove it at home, and what could you do if you were in a place where you don't have access to dental care, because there's things you could do. And the answer is yes, there are. So on the very next slide, you'll see a picture.
Before we go there, I got to interrupt and tell you, I remember when I'm going to refer back to some of the old days with the Bale Duneen crowd.
Yeah.
I remember learning from Brad and Amy that there were studies where they did a stent to cure somebody's heart attack. 90% of stents are preventive and they don't work, but the 10% for a heart attack actually do work. And they've done studies, and the reason I wanted to cover it here was they've done studies where they looked at the bacteria in the clots that they removed from those heart attacks, and the bacteria came from here, right where we're looking.
No question about it. And those studies are pretty impressive. And what I would what I would think about is whatever you have in your mouth, we call it now, well, we call it the microbiome, right? That's what we refer to as all the stuff that lives in your mouth. And there's been seminars done titled The Traveling Oral Microbiome. Traveling meaning it's moving through your body, coming from the mouth, and it's this microbiome. And so, Ford, the reality is there's no question. They use very sophisticated typing too, by the way. They know the genetic address of the bacteria. So they know they came from the mouth. And that's the message. The message is what lives in your mouth doesn't stay there. It travels around your body. And in fact, I think it might be is the next picture a color wheel? I think I provided you. Yeah, this color wheel. You know what this is, Ford? This is a research study showing that what's in your mouth is now connected to 57 other systemic diseases. Wow. I mean, I thought it was heart attack and stroke back in the day, not that long ago. 57 different diseases. I mean, cancer, respiratory issues, nervous system disorders, muscular diseases, rheumatic arthritis. I mean, you name it. I see these health histories that come into my practice, and I'm like, I wonder if the mouth is contributing. Right. And many times it is. So what's our goal in practice? Get the mouth out of the equation. So it's not, something else might get you, but I don't want it to be your teeth. That's the idea.
So another quick break. So Heather, will you please help me with the questions? They're piling up. We're getting tons of them. For example, there's a lot of them about xylitol. There's a lot of them about, as you know, Doug, you and I have covered this issue of nitric oxide and mouthwash and things like that. So
right.
We've got a lot of questions. We do plan to be able to answer those at the end. As many as we can.
Well, let me just say something about in the beginning here about the community of pathogens that live in your mouth. If your mouth is healthy, let's just say your mouth is healthy and you don't have bad acting bacteria in your mouth. Yeah, you can go to the next slide. That's okay. If you don't have bad acting bacteria in your mouth, you don't need mouthwash. I mean, why do you need mouthwash? If you want fresh breath, have a mint or something. You don't need mouthwash to tame any kind of bacteria. So what I'm talking about, what's often very misunderstood, I'm talking about people that have what we call a dysbiosis. Maybe you can explain what a dysbiosis is, but that's the only word I know to say that, when the mouth is imbalanced, it's dys, like it doesn't work well. And then biosis, it means it's disruptive bacteria. So why we use mouth rinses and why we recommend mouth rinses, it's not for fun. It's to reestablish a healthy biofilm. But just like your lawn, if it's got a lot of weeds, you got to kill the weeds first, and then you got to come in and try to grow the good stuff. So if you already have good stuff, you don't need to kill the weeds.
To your point about dysbiosis, I mean, this is what Heather and I and the team deal with all day, every day. We had a fellow named Robert Lustig on the channel a couple of months ago, and
with him last weekend.
Oh, is that right?
Yeah, fat chance,
and he talks about different types of metabolism, and metabolic disease is a whole big issue. I mean, that's what we do with people. We look to see how much their metabolic disease they have. And if you do have, the most common one, obviously, is prediabetes, diabetes. And Robert Van Darth came up with a question, is it correlation or causation? And we'll talk about that. It's actually both, Robert. Again, we'll talk about that a little bit later. But once people get into metabolic disease, especially diabetes, prediabetes, they start creating a whole different set of biochemicals. So their mouth, for example, which is usually protected by one set of biochemicals, has something else growing in it. In fact, it develops a very good medium for the growth of the wrong bacteria. So that's what Doug and the WDN, Wellness Dentistry Network dentists, are dealing with all day, every day.
Yeah, and for just, I think it was Monday night, we did a webinar. And, we talk about metabolics. I mean, it starts with metabolic syndrome. right? You can identify that sometimes just by looking at people. That's if you have 3 out of 5 different conditions that increased neck circumference or waist circumference, and, you're on cholesterol meds or you have hypertension, what that is. It starts at metabolic syndrome. So we try to teach our member offices how to identify that. And then the next thing you'd want to know is what's somebody's fasting glucose, and what's their, what are they insulin resistant? If they're insulin resistant, the precursor for diabetes. And of course, diabetes, if you get that far, by the way, periodontal disease has an effect all along the way. But if you get that far, periodontal gum disease is now the 5th leading complication from diabetes. So we know that if you're diabetic, your gum disease is going to be worse. And if your gum disease, if you have gum disease, it's going to be harder to manage your blood sugar. So there's that bi-directional relationship. So that's the way I would explain it right now, but you could talk about causation and correlation, because I know Robert has that.
So since you've gone there, Robert, we'll just take a quick detour, bunny hole, and talk about that for a second. The number one cause of gum disease is what, Doug?
Well, it's going to be the wrong pathogens and how your hosts respond, how you respond to those pathogens.
I have heard many times that the number one cause is prediabetes, undiagnosed prediabetes.
Well, there's no question that all along the metabolic pathway of degradation, you're going to have opportunities for bacteria to grow. I mean, they love sweet blood.
So if that is the case, then it's an A causes both B and C. In other words, A being prediabetes, the metabolic disease is causing both the gum disease and the cardiovascular disease. But our friends that we mentioned a few minutes ago, Brad Bale, Amy Doneen, a couple of other folks actually have done research which showed very clearly it's not just that. It's not just A causing both B and C. There's significant B causing C, meaning there's significant cause of cardiovascular disease coming from gum disease itself.
Yeah, there's absolutely no question about that. And that paper that they wrote with Dr. Vigorous was one that showed a causation, and they outlined the mechanism of action in that, smooth muscle transformation, endothelial dysfunction, some of the things you've talked about on your show before. For me, I want to make sure that I don't overstate what it is that we're doing, but there's no question, Ford, that if you don't have a healthy mouth, there's going to be some downstream biomarker that's going to be affected by what's going on in the mouth. And it's way grossly overlooked in our profession. And I want to change that. And I want to work with a group of people in my private practice in Bloomfield Hills, Michigan. I have a group of people that get that idea. And it's fantastic. So what this is on the screen is a picture of instruments that we use to scrape this stuff off the teeth. But I want your listening audience to know these bacteria and yeast don't just live on the teeth. They live in the entire body. I mean, they live in the entire mouth. So what we have in our program is not how to disinfect the teeth, but it's how to, quote, disinfect the entire mouth and reshift it back to a state of healthy balance so it doesn't cause any disease. And this is a good time to mention, we talked about oral microbiome. The slimy stuff that's on the teeth we used to call plaque. We call it tartar, we call it calculus, different words you've heard in the dental industry. But it's really a biofilm. And in that biofilm is not just bacteria, but there's yeast in there too. 40% of my patients with gum disease have a yeast issue as well. So when I do testing, the most valuable test you could get would be a bacteria test and a yeast test together, because then I can figure out what I need to do. And Ford, from being in the medical world, that when you give somebody that has a yeast problem, an antibiotic, the yeast gets worse. So if you wonder, these dentists wonder why their cases aren't getting better or why their patients aren't getting better, it's because 40% of them were not treating the right thing. We got to figure out who's who. And then viruses are coming on. That since COVID, awareness of viruses have come onto the block as well. And so we provide antibacterial, antifungal, and antiviral approaches to those that need it. So it's pretty interesting, and it's the world in the world of figuring this out is exploding for us.
So you're actually going to talk with us later about how to get that testing, right?
Yeah, for sure. Yeah, if somebody wants it, they can do that for sure.
You know, we were talking about this before the show started. Back when I was working with Brad and Amy, we did a much better job of getting that testing done. It was a core part of what we did, but that was a $5,000 service.
Right.
Not that test, but when we were doing it that level. Now that we're doing it for folks, many more folks are getting this kind of service for prevention.
Well, we're going to go ahead, Ford. Finish that comment.
That's one thing that we need to figure out. How can we start adding better testing for this issue, better awareness for this issue for our patients? And again, Heather and Jesus and I will be talking about that.
Yeah, and when I started this journey in maybe 2009, I guess I started this journey, there were only a couple testing companies. Today, there's probably 10. Now, most of them are designed to provide tests for me as a practitioner to distribute, for my patients. But we have put together a group where I can get these. We can basically get these through the mail. So you can, we can order the test through the mail. You can do that through us, and we'll show you. We'll help you with that at the end. But the idea is these testing companies are popping up, and just consumer-driven medical tests they're being marketed to the consumers all the time. But to your point, it's still not super inexpensive, but man, is it valuable data. And you mentioned Brad and Amy, and for our listening audience that don't know, because I invited my mom today for it. My listening audience who don't know, this would be a group of people that teach physicians about heart attack and stroke prevention. And in that group, back then, even then, we only had a couple testing companies that we could use, and now we do so much more, and there's so much more opportunity for that.
Which brings up another point. You guys are now, after some interaction with me, I know, Doug, a few years ago, you started setting up something for telemedicine or teledentistry.
Well, we do. We have it now. I mean, I don't want to if people want to have some input, we can help them. Sometimes I have to get them to a dentist who understands. Many other times we can just work with them over the phone or through the internet. So the idea for it is I really don't want anybody to not have some kind of option, right? Because you hear this. But back to finish a thought process about Brad and Amy's heart attack and stroke prevention course. In that course, there's some thought. They think that 50%, which just blows my mind as a dentist, 50% of the patients that have heart attacks and strokes have undiagnosed dental disease going on, and the dental disease is part of the driver. And for our listening audience to know, what does dental disease do? It drives up some of the key inflammatory biomarkers that cause arterial plaque instability. That's the idea. And what we haven't really mentioned, or we're not going to mention much today, but we could go down that road, is root end infections. We're talking about dirty teeth. We're talking about the teeth that show above the gum. But if you get a failed root canal or root canal infection, that's also very dangerous. And we check for all that stuff.
So I'll make one other comment. I have absolutely no qualms in plugging the Wellness Dentistry Network and the dentists that are associated with Bale Deneen, because I want folks to know that there are options for getting better dental care. Doug doesn't pay me anything. I'd be very happy if you wanted to, Doug, but that's not a requirement. I just want I believe in what you're doing. I believe in what the Wellness Dentistry Network is doing. I believe in what the dentists associated with Bale and Doneen are doing. It's like I said earlier on, it's like the difference between a good prevention doc and the rest of what you get out there.
Well, when I was looking into a little bit of anti-aging medicine and I learned the significance of inflammation and what it does to your body over time, I thought to myself, I'm flying home from a conference and I'm thinking, I got these patients that come in twice a year. I'm looking at them. They're sitting in my chair. Many of them, for it, if they don't have a really good relationship or a really good regular physician program, that you might see them once every few years, or if they have a problem, we see them regularly. The ones that come regularly are really pretty good. And I thought, what are all the things that I could identify for them, easy, or maybe say a few words, or even my hygiene team, right? My periodontal therapist in the office, what could they say to a patient that might pique their curiosity to further investigate, like metabolic syndrome or insulin resistance or pollution or mercury contamination or even EMF pollution, mold exposure. What would these things do to the body? And then how do I teach my fellow dentists to be able to have the same awareness? That's what started the Wellness Dentistry Network. But I got to tell you, in the beginning, 2009, it was tough sledding.
Oh yeah, I remember when you called me one day to ask about, Ford. We see all this, and we see it much more than the doctors. The doctors, A, don't have time to see patients. We see them more than they do. And B, they don't know what we both knew. They didn't know what they were looking for when the doctors saw them anyway. How can we teach the dentists? And you and I started talking about blood test panels, including pre-diabetes related information, A1C, things like that I think dentists can do a lot with. And I remember you just got pilloried. You got banged on for doing that.
I did. And, Ford, I know I've said thanks many times, but I really thank you because you gave me the courage, along with some legal counsel, that, hey, dentists have the right to know these things. We have the right to know some of these blood biomarkers because what we're doing directly affects those. So we have our Wellness Dentistry Network member dentists can actually order some basic medical tests, just like you have the ability to do some saliva testing for some of your patients if you wanted to do that and if it was part of your program. And so the idea is all the science that's come out in the last 15 years, 120% supports the approach that we're taking. And how gratifying is that? Because it's so relevant to overall health. And when the science is true, I mean, it's necessary. So there'll be a time where we're thought much more like an oral physician, and we're doing much more with testing and biomarker testing. But we got to get out of that old adage that you so eloquently described in the beginning, where we're just drilling and making money doing fillings. And let me tell you, that's way more lucrative than looking at someone's saliva.
Oh yeah.
But looking at
procedures.
But
do a procedure to somebody.
Yeah, but looking at somebody's saliva, you could save someone's life. Yeah. And and I'd rather have a whole lot of people that are smart and that know what they need to do, and we help them stay healthy, than just a bunch of people that have disease that I have to go in and try to stamp out every day.
Mm-hmm.
So Heather, I'm just going to warn you, you've got Jesus's difficult job of reining us in to try to keep us in an hour.
All right. Y'all are doing good.
I don't know what's on the next
Good
slide.
luck.
I don't know what's on the next slide, Ford, but the next slide, I think, is somebody will ask me occasionally, a little scared, what do you mean these bacteria? I mean, these bacteria grow. Why do they grow? And what happens when they grow? And you hear about people who say, I'm getting long in the tooth. I have, we call that gum recession, where the gum recedes away from the neck of the tooth. And what this picture is on the screen, it's a picture of obviously an ocean graphic. And what it shows is that different species live at different depths of the ocean. You don't find things that grow on the bottom of the ocean floor at the top. And it's the same thing with that crevice between the tooth and the gum, that pocket, if you call it, or however you want to describe it. But as it gets deeper, and we measure this every day for our patients, as it gets deeper, it selects for bad acting bacteria and you get a shift. That's the idea. So you get a big shift. Ford, I got to do something really quickly that I overlooked. Hang on a second.
Sounds good. So I love this slide, Heather. People think that Doug made an error and started putting some oceanographic slides in there. But it's a really, really good point. It's the sort of thing where you connect the dots that, oh my gosh, it makes sense when you look at the ocean. The deeper you go, very, very different levels of animals. And the same thing here, very, very different levels of issues. This is also, while Doug's away, I'm going to go ahead and take over for a minute. I think this is also one of the issues. We've talked multiple times about doing something at home versus getting something done by professionals. I'm going to tell a quick story. I worked with one of Doug's dentists for a long time. I actually went in, saw his whole staff. He had 4 different dentists. He had 30-something people on his staff. And he and I were talking one day, and I said the wrong thing, and I regret it. Here's the thing that I was talking about. And it's an issue for what we do too, Heather. You and I can only do so much. We can only train so much. I mean, we can only do medications are not going to fix a lifestyle.
Right.
And that was what I meant when I said, so Dan, I think people are way too dependent on the dentist's office. Mm-hmm. And I know Dan never mentioned it to me again. He's another dentist within your group, Doug.
Yeah.
But the point I was making was the importance. You know, if you work with somebody and they never take care of their teeth, you've got a whole different set of work that you got to do. Right. That does not mean that working with the dentist, working with the doc, working with the hygienist is not critical, because I'm never going to get down into those lower depths of dealing with these. What do you call these gaps between the?
Well, we call it a pocket.
Yeah, I'm never going to get down into a pocket like you guys are.
No, you can't. And that's why we have specialized instruments to get down there. You know, that's the idea. But, you know, what you said to Dan, and, you know, you raise an interesting point, because there's a dentist who wrote a book called Kiss Your Dentist Goodbye. And the idea was, what do you need to do at home, and what can you do at home? If you have this dysbiosis and you want to try to rebalance it, could you do that? And we do share some techniques with people where they can just get all the products they need at CVS or Walgreens or, you know, some pharmacy somewhere, and they can, or even a big box store these days, and you can get what you need. But what you have to do for it, and what you are alluding to, is you have to change some of the strategy of your home care. Maybe it's the order that you do things. Maybe it's what you do at home. But I learned the significance of this during COVID, because during COVID, my practice was shut down for some months. And then I had people that were fearful to even go into a healthcare setting. So I saw people that had significant disease prior to COVID. We stabilized the disease through treatment, and now they have a different home care regimen. Now they're not in the practice for a year or two. And they come back in, and what do I think? I think, oh my gosh, they're going to be terrible. They come back in, they don't look so bad. They might be slightly regressing, but they don't look anything like they looked when we first started to treat them. So what does that tell me? It tells me exactly what you said. If you really learn what to do at home and you learn how to manage your mouth, you might be okay if you're not going in as frequently as you once were. Now, I don't want to be a proponent of saying you don't need to see the dentist, because if you have gum disease, you're way more susceptible to get it again, and to have it reactivate never really goes away. It just gets stable, and that's what we stabilize people. But what happens is we want to make sure that we give you the tools so you can take care of it at home. I don't want you to have to be dependent on me, but I want you to want to come in to see us so we can give you positive feedback. We can track the disease and monitor it, and we can make sure you're doing okay. And I have people that we've done tests on 15 years ago. We readjusted the biofilm, retested to show it was adjusted, and they've never ever gone back to having biofilm like they did when they were diseased in the beginning. And my challenge to my dental colleagues is that's the way we should be managing these kind of infections.
And that's what dental care should be like.
That's it.
Not drill, fill, and bill.
Yeah. And so why did I create the Wellness Dentistry Network? Because wherever you are in the world, you should have access to somebody who knows what they're doing in that department. It's not just don't come to my office, although I did have someone come from Belgium to my office. So, I mean, it wouldn't be out of the park. I'm available. But the idea is I don't want it to make that complicated, right? It doesn't have to be that complicated. That's the idea. So this is another from one of our testing companies. It's a picture off their website, but it's just another good reminder for our listening audience that, look, you know, what grows around your teeth and what's in your mouth can affect a number of things, and not just bad breath, but it can even have huge implications for a pregnant woman, anybody with heart disease, diabetes, stroke risk, arthritis. Again, how many? They couldn't put 57 pictures on here. Mm-hmm. That's how many we're talking about now. So it's all my cancer patients are getting salivary diagnostically tested. So I know what's going on, and then we help adjust that. And we have a team of professionals there at our office in Bloomfield Hills. I have Dr. Watkins is my dental associate who gets this idea. My team gets this idea, and we're willing to help anybody that needs it. That's for sure. So Ford, you got to have some questions by now that maybe there's a good one, or you want to start looking at. Oh yeah, let's hold that thought. Cavities. If you have had multiple cavities in your life, or you have had repetitive cavities every time you go into the dentist, or if your children have, or your grandchildren have, that again is a biofilm. That's another dysbiosis, but it's a different kind of bacteria. We can test for those too. And I don't talk much about it in this segment, but I can tell you, if you want to stop that process, you got to adjust the biofilm, and then you won't get cavities. So cavities are a very difficult thing. And what this is a graphic that we use to teach patients. And what does it say? I'll just review it kind of quickly. The very top line says bacteria in the mouth feed on sugar. The number one thing you can do as we start to get into remedies of how to prevent these diseases is stop eating sugar. And that's what Rob Lustig would say. He wrote Fat Chance and Metabolics and different books. That's the first thing is stop sugar. I have a book that we give to a lot of patients in the office called SOS, Stop Only Sugar. If you want to make a huge health change, stop eating refined sugar. And then,
so to your point about that, stop only sugar, it really is referring to sugar, sugar-related items. Many of us are beginning to refer to bread and white flour grain products as sugar as well.
Yes.
And it's for reasons that might not be so obvious. White processed grain products, white flour, has a glycemic index. It makes your blood sugar rise faster than table sugar. And it does because it's just micromolecularly, pardon that term, that geeky term, the molecules are just one sugar molecule hooked to another, to another, to another. And it takes our body literally seconds to disrupt and create blood sugar out of white flour. Same thing with rice. And as you said, we'll talk a little bit more about that later. We've got a whole section on quick Q&A questions. We'll cover some of those a little bit later.
Okay. So these sugars, or Brett, you just ruined my pizza dinner. Go back to so what happens is then the bacteria, they eat the sugar, and what they make as a result of that is acid. And the acid is what erodes or eats away the enamel of your tooth, leaving a black spot or a hole or whatever that is. And so we can stop that process all along the way by either eliminating the bacteria that are causing the problem, eliminating the sugar that feeds the bacteria, or we can harden the tooth. We can harden the tooth. And I don't want to open up the whole fluoride Pandora's box, but I'll tap on the lid. And what I would tell you is that fluoride in a topical form is the only way I would prefer to use it. And I would only use it on people that have this disease, because I can tell you nothing can harden the tooth surface faster than a little bit of fluoride treatment. And that's why we put that. That's why we use it topically only. And if you look at any of the videos that were made about the fluoride conspiracies, they'll tell you, those scientists will say the only way fluoride should be used is in a topical application where you're not swallowing it. That's the idea. So I can summarize that, easily. Now, as this process of cavities goes deeper, it obviously affects the nerve of the tooth at some point, and people will get a dental abscess. Because of it, that's what drives the root canal. So I don't want to say too much more about the process, but what's the similarity between cavity-causing bacteria and gum disease-causing bacteria? For that same scenario that you talked about in the beginning of the show, where they do endarterectomies, or they take the clot out and they look at the bacteria in the clot, they find the cavity-causing bacteria there too. So it's the same thing, it's just a different mechanism. Now, these are different methodologies to clean the bacteria, yeast, and viruses off your teeth. And the idea is you want to have some methodology. For people with healthy mouths, no dysbiosis. By the way, you can't tell by looking with your eyes. The only way you can really tell is to get tested. And one of the reasons why is I'll see people with what I think are really healthy teeth. They have bad bacteria, but it could be coming from or being contributed to by a significant other, or somebody they're exchanging saliva with. So sometimes we treat families based on what we see. But the idea is you have to have some methodology for cleaning out in between your teeth. And that's going to be what most people would say is going to be brush and floss. In my day, back when I first bought my practice, I knew two things to clean teeth: brush and floss. That was it. And I used to tell everybody, if you have a dirty, filthy mouth, it's because you're a bad brusher or you don't use dental floss. And the reality is that was not only insulting, but it wasn't so true. The idea was there's many tools now, little brushes, things you can put in between the teeth, picks and sticks. As long as it doesn't hurt the gums, I don't care. You use whatever you can do to get the teeth clean in between. And once you do that, if you do that regularly, it's the bacteria, yeast, and virus that live on the tops of the teeth that help provide a support mechanism for the ones that are trying to grow under the gum, like the ocean picture. So the better you do with the tops of the teeth, the less involvement you're going to have with the nasty microorganisms. Now,
so it's a team approach.
Correct.
We eat the right stuff, number one, including, and
sugar.
Most importantly, don't eat sugar. And that includes white flour, rice, other high glycemic food products. Number two, we take care of our mouth. We take care, we brush, we make sure that we keep junk out from between teeth where we can get to them. If we do that, your job is so much easier. You don't have a major cesspool down in these pockets that you've got to try to dig out.
Yeah, and not to mention, the gum disease bacteria don't have that support network, right? That helps feed them and bring food to them and makes your gums inflamed, so it's leaky and weepy, and there's, pus and stuff floating around that the bacteria eat off of. We want to make sure we do the tops of the teeth and in between the teeth. Now, when you start to get some gum recession for it, and we talk about people use that term long in the tooth. What that means is that the gums are receding. Well, the teeth are kind of cylindrical, they're ribbon shaped, they take on weird shapes as we get lower in the tooth root. And if that gets exposed, your dental floss is not helping you, because the dental floss it just doesn't have enough contact area. So maybe that's where we go to something like we call oral irrigation, or maybe you would know it as a water pick or a hydrofloss. These are some brand names of some of these oral irrigators. And I think the next slide says, why does an oral irrigator work? Or why could this be better? Because when you have pulsating water, you have this hard stream of pulsating water blasting against the side of the tooth. It's like pulling your car into a high pressure car wash. And what will happen is the force of the water will help obliterate the biofilm, and it's more effective. Is it the answer? It's not the end all answer, because there's other things we can do too, but it's significantly more effective, and it's better than just brushing and flossing alone. I have people that do all three, and that's really great. But the idea is the power washing of the teeth with like a water pick type instrument is also a huge asset. The other thing is, and if people work with us or want to call and network with us, we're happy to guide and teach people how to put other things in with the water that makes it even more effective. So you can actually turn your water pick into a little home medicine cabinet that you can wash the teeth with certain things, but it depends on what you have. I don't want anybody washing the teeth with something they don't need.
Right.
So I've got some pockets. I think I'm not sure, but I think the deepest they go is like 3.
Well, that's good. That's normal. That's good.
So, but maybe I have a 4 or a 5 somewhere. I don't know for sure, but I will say this. So I mentioned in the intro that a friend of mine got me a device. It was one of these water picks, and I had heard you and other WDN dentists talking about these things. And I had gotten one in the past, but you got the tube and you pull that, you pull that thing out and it pulls the thing over it. It's a mess.
Yeah.
Well, what my friend got me was one of these that's got the little, it's one piece. It's got the reservoir on the pick itself. So you've got one device, and it's so nice. You don't have tubes flying everywhere. You don't have water flying everywhere. And here's what happened. Within 3 days of my first use, it was like I felt different in my mouth.
Yeah, there's no question about it. And what you're describing is like the handheld devices or travel devices. You can use them in the shower. The only thing is that big reservoir of water, they're usually about 20 ounces, 21 ounces, somewhere in there. It's really designed for a single use. It takes about 2 minutes to water pick the whole mouth effectively. So if you're using one of those handheld devices like that, you just might have to fill it up a couple times. When don't just use one. The one tank's too small. So I would use it. Maybe use it on half of your top teeth, fill it again. Use it on the other half of your top teeth, fill it again. Use it on half your bottom teeth. Because you want to work on the teeth from the outside and from the inside out. So yeah. you want to do both. So
we're watching about 12 minutes, guys. Just wanted to let you know.
Okay.
Thank you. It's not an easy job, is it, Heather?
No, it is not.
Well, Heather, what do you have for us? You have to have a question for us. What do you have for us?
Especially when you got a couple of windbags like us.
Right. So the biggest thing is, for our patients, what can they do at home to kind of prevent these issues? We've kind of already gone over that, but just to kind of re-emphasize those things.
To summarize that, let's say it really simply. You need an effective methodology. You need an effective way to clean the bacteria off the tops of the teeth and in between the teeth. Not just so a brush alone is not going to do it, because that doesn't get you in between the teeth. So in between the teeth, you have to pick one of these instruments to go in between the teeth. And depending on how much space you have between your teeth, that'll determine how it fits or if it fits or not. And then you have to find, then you would want to know how dangerous is the bacteria, yeast, or viruses in my mouth. And I can usually figure that out off a health questionnaire, some series of questions. And if it's dangerous, then it should be adjusted. And we have to adjust it, much more. So I have there's 3 words on the slide right now. And what we're going to do is I have information about my private practice and my practice partner, Chelsea Watkins. And then we have a teaching site, this whole teaching site for dentists that are interested in this dentistry concept. That's the Wellness Dentistry Network. That really is a resource for dentists. Why we've mentioned that for the consumers and for you is that you can find a wellness dentist if they're part of our network. So encourage your dentist to be part of it. We'll teach them all they need to know about all this stuff and a lot more. And we can, we'd love to help them. And then we have a website that can provide some testing options for the public, if the public is so inclined. And that's the homedentalexam.com. That's the bottom of your screen. It says homedentalexam.com. And for anybody that's listening today, I just wanted to do something kind of special for Ford. Let's make no bones about it. If you get an oral bacteria test and a yeast test and a consultation about it, it can be a little bit pricey. It's normally $470. And we want to give about $150 off for anybody that uses that red coupon code. So I see there's a black coupon code on the screen too. That's not active, but the red coupon code is just designed for Ford's group.
That's great. Thank you so much.
And that's called Brewer 150. And it gives you $150 off online. There's a line on there where you put in the coupon code. You could do that. But I wanted to give some options for people to understand this concept and what we're trying to do. And I really want to thank Ford for the opportunities, but we really want the front-facing public to start to demand some of this stuff from their dentist, because your life could be significantly shortened. And Ford, we didn't talk about it, but one of the other big areas with vascular degradation is cognitive decline. So dementia.
Oh, I'm glad you brought it up.
Yeah, it's huge. So I think one of the books that writes about that says your dental hygienist can delay the onset of Alzheimer's or dementia by a significant number of years by helping you keep your mouth clean. That's the idea.
It's amazing. Great. So do we want to address some of these questions from the audience?
Yes. Gilbert, if you'll give us the water ball. So Heather, take it away.
Well, unfortunately, I'm not able to highlight the comments today for some reason, so I'm going to have to rely on you, Dr. Brewer.
Okay, so tell me, do you know the ones that you want to hit first?
There was a question here about a lot of questions about mouthwash and does that kill the good bacteria, the bad bacteria, both? So I think we need to kind of give some clarification on mouthwash.
Yeah, that's perfect. I'll take that. That question, yes, it depends on the harshness of the mouth rinse that you use, but most of the mouth rinses are what we would call non-selective. Like it doesn't know if it's a good bacteria or a bad bacteria. But here's what we have working in our favor, Heather. The good bacteria far outpace the growth of the bad bacteria. So even if you diminish the whole population, in a couple of days, a more healthy bacteria will be there than bad bacteria. So where we use rinses, therapeutic rinses, is when we're trying to shift from a bad situation to a good situation.
Gotcha.
And the only way we can do that is to know we can test, and then we can find out if you have bad stuff, then we would have you use a rinse system and we'd have you test sometime later. And there's a key kind of a time when you would do that. So the idea of beating down the biofilm using a harsh mouth rinse is not a bad idea, but only if there's a dysbiosis. If there's not a dysbiosis and your mouth is perfectly healthy, or you've gotten to stability, then we want to use the easiest maintenance rinse or even no rinses that's possible. And that could be something really weak and simple. And I can tell you it's confusing if you go into the drugstore aisle. I could talk all day about the rinses that are in the drugstore aisle. There's way too many choices.
Yes.
And most people, if you have a healthy mouth, you don't need a mouth rinse. You can get by with just brushing your teeth twice a day, getting the food out, cleaning the tops of teeth, cleaning in between the teeth, and maybe incorporating a couple of healthy habits, eliminating sugar, the foods you eat. And, the foods that we're trying to support for people to eat is like a Mediterranean diet. A lot of vegetables, few pieces of fruit, and then small pieces of healthy meat, but not a big steak like we used to eat, and mashed potatoes and gravy. Right? That's not happening anymore.
There's a bunch of us that are starting to push back on the Mediterranean diet, especially the one that American style, where you have way too much grape juice, grapes, grain products, breads, sugars, things like that.
Yeah, for sure.
But the old original Mediterranean diet may actually, it's not so bad. While we're talking about mouthwash, Chris Linke, a member, actually mentioned something that you're talking about. In the past, you and I think others have said, be careful about just nuking your mouth every day with some of these hydrogen peroxide type mouthwashes. They may be doing you more damage in terms of nitric oxide.
Yeah, most of the mouth rinses that have the most killing power are chlorine based or they're iodine based if they have really, really strong killing power. Most of the prescription rinses are done that way. When you get into peroxide, it's pretty worthless. If you get into some of the essential oil rinses and some of the other rinses, they're going to be a lot less effective at microbial killing, but they will have some effect. And there's some plant-based rinses out there that you can get that will have some antimicrobial capacity, but nothing like chlorine or iodine. Those are the two big things that we use in medicine. You go to the hospital and they cut open your belly, you come home with an orange spot. That's because they rubbed you down with iodine before they made an incision. And so it's a very effective antimicrobial, but it has to be used a certain way. So we use that professionally. And what Chris is alluding to, that is if you're taking out a lot of the healthy bacteria every day, we know that nitrates are made from foods that you eat, green leafy vegetables and healthy foods rich in arginine and stuff will create a chemical on the back of the tongue, and there's certain bacteria that will use that to make nitric oxide. And he's right, that does happen. However, if you have a dysbiosis, and this is what we've been talking about a lot, if you have a dysbiosis, the risk to your health by not addressing the bacteria far, far outweighs any couple mgs you're going to get in increase in blood pressure from taking out the healthy bacteria. And what is my big message and mantra once you get your mouth healthy? You don't need harsh rinses every day when your mouth is healthy. So there's no reason to use those when your mouth is healthy. You only use them when your mouth is not healthy. Use them for a time to get your mouth healthy, and then you stop.
And xylitol benefits.
Yeah, xylitol is a nice product. It comes from a birch tree. It's natural. It's nice if you don't have to ingest it, because what will happen with xylitol, you need 5 to 7 grams a day, and you can get it in gum and mint form and other kinds of things. But it's a biofilm buster, and the xylitol sweetener can't be fermented by the bacteria. So the bacteria can't use it. So xylitol is a beautiful thing to incorporate. But you could get powdered xylitol. You could put it into a cup and make a little slurry rinse, and you could swish with it and spit it out. Why don't you want to ingest a lot of xylitol? Because sometimes you can get gassy and you might not have so many friends.
Right. Yes.
Too much xylitol. So that's the idea. It can cause some GI issues for some people.
I like the swishing idea. That's good.
Yeah. Is Larry asking us a question about false teeth? Larry, one of the big things that I see with people with false teeth is they have a tremendous overgrowth of yeast. So there's no question that the bacteria are living on the false teeth, but they're also living on the tongue, the cheeks, the tonsils, other areas of the mouth. So even if you have false teeth, I have 2 important questions. Why did you lose your teeth? Did you lose them from gum disease, or did you lose them from dental decay, caries? Those are bacterial infections. Those bacteria can live in your mouth for decades after the teeth are gone.
Wow.
So you got to be looked at.
And then what about turmeric brushing? I've seen a few questions about that.
Yeah, it's there's different things that come out. The concern about some of that stuff is how abrasive the paste is. If the paste is really abrasive, or if the product in the paste is really abrasive, you can wear away and ditch out the enamel and ditch out the root surfaces of the teeth. There's almost no toothpaste that has enough therapeutic value from the chemicals in the paste to change the biofilm enough to get it healthy if it's really sick in the beginning. So I would say the best thing to do is test, and then go from there. I can see the questions on the screen now. Is there any indication for dental x-rays annually? We take dental x-rays annually because your insurance company pays us for it. But the answer is, I would ask you, when's the last time you had a cavity? If you haven't had a cavity in years and years and years, I'm going to push that frequency out. I don't need to take those x-rays yearly. But it's not. But if you're a cavity risk, believe me, I want to know. I want to be looking at the in between your teeth radiographically as much as I can, and typically annually would be great. But if you're low risk, no, we stretch that out. Our practice, our teaching, and our whole, it's a risk-based system. I want to provide everything you need, nothing you don't, and we do that based on your risk for disease. So guess what? The people who are sick get more. The people who are healthy get less because they need less.
Love it.
I don't care what kind of brush you use, Burgess. If it's a Sonicare, if it wiggles, goes back and forth, round and round, makes no difference to me. You got to put it in your hand, hold it to the tooth. You got to brush with a brush you have that you enjoy, because then you're going to do it. So the idea is, you can even do an effective job with just a handheld brush. But to your point, the power toothbrushes do better, because you just have to hold them to the tooth. I could talk about this for 5 minutes too, but I don't want to. But the idea is, many people get a power toothbrush and then they use manual toothbrush behavior with the power toothbrush. And you don't need to do that. You just want to let it sit at the gum line and let it do its wiggling or oscillation or whatever it does.
Interesting. Okay.
Just wanted to get a plug for what we're talking about. I know you've gotten pounded for doing non-dental stuff, end quote, by doctors. And that's just so territorial and so stupid. Just plain stupid.
Yeah, well, I have dentists I have physicians from other parts of the country that refer me patients. And for people like you who understand the process, those folks just have some further learning to do if they're worried about that. Because I can tell you, if you're trying to get a cardiovascular disease or a diabetic patient stable, you need to know what's going on in the mouth. You have to. Yes. And if you don't, you're going to miss it. And what I need to do, I don't treat arterial disease with statin drugs and with niacin and with other things. I refer them to you for that. So I'm staying in my lane, but are our lanes getting blurred these days? Absolutely.
They should be.
Yeah, they should be. Right. We're driving on the same highway.
My wife is a dentist and says my teeth are cleaner and have almost no tartar since I have been practicing fasting and time-restricted eating. That is a case study of one, but to me, it is amazing.
Yeah, you take away the stuff that the bacteria use to grow, you get less of them. So that's the idea. Time-restricted feeding is, Ford, you have whole hour programs on fasting and time-restricted feeding. And there's no question that when you put less stuff in your mouth, you're going to have less bacteria grow.
Absolutely. Yep. You're going to basically starving those bacteria and fungus and viruses. Yeah,
I did mention Ellie's book. I just didn't mention Ellie by name, but I think Ellie has a lot of anecdotal and observational data. And I tried to work with Ellie to put some actual saliva testing to it, but it was a little bit late in Ellie's career for that. So we did a few things with it, but I've been doing that myself, and the story is crystal clear for me. We have to test, and when we find out you have bad bacteria, then we can employ strategies. And some of Ellie's strategies are actually well-founded. So I have no problem with that.
Floss. Do we need to floss in the morning if we floss the night before, since we did not eat while we were sleeping? That's a good
Well,
question.
you know, I don't know who Video Share is, but whatever the name of that person is, if you were to do it 100% effectively when you did it one time a day, that'd probably be good. But the reality is we miss spots and we don't do so well. So if we can do something every 12 hours or so, it's going to be a lot better than do it once in a 24-hour period. Best time to brush and floss and coat your teeth with anything is just before you go to bed. That's because you don't have a lot of saliva flow at night.
Very
And
good.
so, and saliva helps to buffer. You know, the saliva has good stuff in it that helps beat down the biofilm.
Once a cavity develops, there is no reversing it?
Kim, only if it's really, really small. If it's really, really tiny, you might be able to what we call remineralize it, but you're correct. Any tooth in my practice that has an active cavity on it without treatment is hopeless. It will eventually not make it. So we need to intercept that problem. But if it's caught early enough, there are some strategies you can do to arrest it.
What about toothpaste with fluoride?
It's topical, no problem. If you have cavity issues or you want to prevent cavities, no problem. Spit it out. Don't swallow it, and don't give it to your kiddos if they swallow it. That's what I mean by that. The chlorhexidine, I have a strong opinion about chlorhexidine. There's people that have died from allergic reactions to chlorhexidine. It impairs normal gum healing development, fibroblast development. I have no place in my practice for chlorhexidine. I threw it out 20 years ago. Oil pulling. A lot of time, if you spent the amount of time oil pulling with a toothbrush in your hand, you'd be amazing, because it takes about 20 minutes a day to oil pull. So where you get some benefit from oil pulling is the friction that's caused by swishing the oil between the teeth and some antioxidant properties of the coconut oil or whatever you're using. But is it going to fix a dysbiosis? Absolutely not. Only if Brendan says, does periodontal curettage help, which is periodontal treatment, help clear the dangers? It does help, but it has to be followed up with meticulous home care. So again, any surgical procedure or any debridement procedure that's not followed up with a really good home care strategy, it's not going to get you to the finish line.
Well, Heather, speaking of finish line, you may not have gotten us in under an hour, but you did a heck of a lot better than Jesus usually
Well,
does.
thank you. We'll have to let him know that. I have some bragging rights over him.
It's a fascinating area for it. I'd love to come back and talk about any one of these points if you want to get into more detail ever. I just love when people get the idea, and I love to see them have a healthy mouth.
I love it. It's been great. Thank you so much.
You're welcome.
Anything else from either of you?
I think we're good.
Yeah, and it's again homedentalegam.com if somebody wants a saliva test, and don't forget to use the coupon code, because we want to make it as possible for you as we can.
Oh, I was going to show there we go. That's right there.
Yeah, so that red coupon code Brewer150, and then the website URL is right at the bottom.
And from my perspective, as usual, thank you for your interest.
Bye, everybody.
Thank you, Ford.